We are here for Nurses Week, and thank you for having us back. So why do you think nurses should care about this? So we can save lives, and hopefully we can embark on a research study and have the nurses teach the patients about sun protective behavior. You have hairdressers that are in the community saying, oh, this thing in your scalp doesn't look good, you should go to the dermatologist. Nurses need to be doing the same thing. We check every person's skin that comes into the hospital, and we should be saying, you need to use sun protective behaviors, and here's what you can do, and point out moles that are not, that look bad, all right? Skin lesions that don't look good. Last year I did this talk, and Karen, who works here, was in the audience. And I'm going to ask Karen to just say a few words about what happened to her.
Last year, I guess you could have seen me on the video, so I was here last year. And when I went home, I had actually on my shoulder a little lesion that I had been looking at for a little while and knew that it was, just kind of there. And I had been saying to myself, I have to go to the dermatologist, I have to go to the dermatologist. So since I went here, I said, wow, I better really go. So I did go. They did a little biopsy, and he said, well, 97%, I think this is really nothing, okay? However, it came back, and I had a melanoma. And thank God that I went to this, because I probably would have put it off again. So they did do an incision. I have on my shoulder, this thing was actually, I can tell you, is probably this big, all right? I have an incision on my shoulder that's this long. They had to do what they call like a shark bite, all right, and to take it out. And luckily, I did have to go for a follow-up oncology at NYU. One of the people that was on here, Dr. Anna Pavlik, and luckily she said, you don't need me. So I am free, but it was pretty scary.
Thank you. Thank you for sharing your story. So it's important, and as healthcare providers, sometimes we put off getting these things examined as well, right? And Elena, another nurse in the community who was at our presentation at Mercy Hospital the other day, also has a story to share.
Hello, everybody. This is my first year here. I'm a nurse, and I also took care of oncology patients for 21 years. So I considered myself in the elite about cancer protection, and that's not what happened. I had been going to a dermatologist for years. My whole family went. I have 3 children. We've had dysplastic nevi in our family, so I would say on average I went once a year. I've had things cut out. They said they were pre-melanoma or a dysplasia, but I felt like I was doing enough. And similar situation happened to me, that I was looking at my skin one day on my arm and something appeared. And my point is that this did not look like any of the pictures that you saw. It was a freckle to me. I have freckles. I've had moles. This did not look like a mole. And I was scheduled for my appointment. At the time, I said, oh, maybe I'll wait. But something told me just to go. And when it was removed, there was no discussion. It was the usual routine for me. And a week later, I got the phone call that it was melanoma. So I thought a little bit differently than a lot of nurses do, because I'm in the field of oncology. And I guess had the advantage or disadvantage of seeing people go through chemotherapy and radiation, and a lot of them died. So I had a lot more fear than the average person, because a lot of people say, I had a melanoma and it's gone. Well, I was lucky. It was stage 1A. My long-term prognosis, because I can be very clinical, is like a 90% chance that it won't come back in 10 years. Those are pretty good odds. But my point is that it's really important, if you feel that something is not normal, or you get a new freckle or a birthmark changes, to go. And also, as nurses, we need to start really paying attention to people's skin and educating them about skin protection, because we can make a difference and we can save lives.
Thank you.
You're welcome.
Thank you very much. So thank you, Elena and Karen, for helping us and personalize this risk. So these are nurses that have had this experience. We live on Long Island, and many people take advantage of the sun, even though today it's pretty miserable. And this winter has been miserable, yes? So I imagine a lot of people are going to really want to get some sun this springtime and summer. So what should we be advising our community? What, say that again? Sunscreen, yes, okay. And what else? Yes? A large brim hat. How wide should that brim be? 4 inches. All right, great, yes.
Just on a daily use, if you're not going into the sun, you should use like a facial cream or concealer or whatever with some sort of SPF in it.
Okay, what would be the ideal number for the SPF? 30. Okay, good. Should you put that on before your makeup? If you wear makeup? Yes. Okay. Excellent. Thank you. So if it's cloudy out, should we tell patients to wear sunscreen? Should we also role model that behavior? Yes, ladies and gentlemen? Okay. What if you have black skin or a person of color? What should you do then? Do you have to just, I'm cool, I don't have to worry about that. Is that correct? Sorry? Same rules apply. Okay, great. So you're very, very knowledgeable about this. So my goal here today is to try to help you increase your knowledge, maybe get you a little worried about some protective behaviors so that you might change your own behaviors, okay? How many in this room go outside and don't wear a wide brim hat when they're going to be outside on a sunny day? Okay, so many of us, right? How many of you go out to do, I'm just going to pick a few weeds so I'm not going to bother with the sunscreen, blah, blah, blah. And it turns out you're out there for an hour or so and you get a little bit of color, right? Okay, how many has that happened to them? Myself included, all right? How many of you have purposely tried to get some color? Purposely tried to get, right, change your color like you're a chameleon. Okay. How many of you have taken care of patients with skin cancer or know people with skin cancer? Okay. How many people know somebody that's died of skin cancer? Okay. Okay. So I think I have an audience with a vested interest here, and especially since you're nurses and healthcare professionals, I think it would be really great if we could increase the knowledge of the whole community and educate each and every person that comes through our doors. Okay? So that would be one of the really great goals if we can manage that. And as we know, we're here because this young lady lost her life to melanoma, and we want to prevent those tragic deaths, right? Okay. So sometimes people go out and want to get bronze skin like this. So it's now May something, even though it doesn't feel like it with the weather. So a lot of people are going to have proms and graduations and things and wear those white dresses, especially the young girls in high schools and whatnot. They're going to want to do what? Tan. So they might go outside, but it's not so great outside, so they would go to where? The tanning salons. Do you think they're healthy? No. Why? The ultraviolet light, the same thing, right?
It's more in a condensed, shorter amount of time.
It's more, right? And it's a short amount of time. So you basically go into a microwave oven and cook yourself real quick and change your skin color. How in the world could that be healthy? So what happens is the sun's rays actually change the what? Right? The DNA. It can cause aberrancies and cause skin cancers. All right? What happens is it goes down into the skin and it gets the melanin to come back up to the surface, especially if you're lighter skinned and you were supposed to live in a different country. Like my skin, I was supposed to live in Ireland and it's really rainy there, okay? And then instead, throughout my whole childhood, I burned myself in Jones Beach. Because back when I was a kid, we didn't have sunscreens, right? And we had the baby oil and the iodine and and all those kinds of things. So what would happen to my skin, and many people that have very fair skin, is we'd go there and our skin would start screaming, oh my gosh, you're burning me, help, help, help. And it gets the melanin from the lower levels of your skin to come up to the surface and it changes your color. It will get either more freckles, burn, or get tanned. So is a tan healthy? No, good answer, okay. Is any tan healthy? Okay, can you do a spray tan? Yes. Can you use bronzer makeup?
Yes.
Okay, so if a young person especially wants to do that, say, okay, I'll spot you the spray tan. Do that. Do not go into that cooking machine. Okay? Very, very dangerous. Yes?
I have a question with the spray tan. Isn't like there potential like whatever chemicals are in that? I mean, it's still all
They do have organic spray tans that you can get that, you know, made of organic stuff. I don't know what it's made of.
We're gonna find out about those side effects at some point in the future.
Well, if that is your fear, then just leave your skin alone. Love the skin you're in, right? Why do we have to keep on saying it's good to have darker skin, tanner skin, right? You know, Caucasian people are either kind of yellowish, pinkish, all sorts of different shades. Just leave it alone. It's your largest organ of your body, and you have to protect it, right? And that's what we should be teaching people and what we should be role modeling. So you could go tanning like this lady, right? And I don't mean to pick on her, because sometimes people get like addicted to going tanning. And that's what happened to this lady. And her daughter has, you know, very fair skin. She was accused of taking the daughter there, but she didn't have her daughter go tanning. But I imagine mom's skin was pretty much like daughter's skin at one point in time. What is that lady's skin going to look like in 10 years? You have taken care of patients like that, right? With the leather skin, looks like an alligator, really rough. You try to give that person a shot, you can't even get through that skin, yes? Okay. And that's because they've changed the basic matrix of their skin through all of that sun damage. Okay, what happened to this guy?
He had it on one side, driving.
Driving, yes. What did you say? Truck driver, you got it. You even got his profession. You get an A. Okay, so he had the sun beating down his face. So what happened to his face? One side got sun damage. What happens with that damage? What does it do to the skin? How come he's all saggy and wrinkly? It changes the skin, okay? It loosens that collagen so your person gets saggy, gets wrinkles. So who in this room would like to get wrinkles? Come on. Who wants to get saggy skin? All right? Mine is just happening on it all by itself. And because I got all those sunburns as a kid, okay? So we want to protect it. You can get these brown spots and these white spots and all sorts of spots on you. And yes, dermatologists can take that off for a pretty penny, okay? But you don't want to have to get things taken off. Plus, it's very painful. So I call it an aging machine. Why? Just for the picture beforehand, right? He aged his skin. So select a cancer. Basal cell, squamous, melanoma. Your choice, okay? And this is a film that we're going to show now.
Warmer weather means more people will be soaking in the sun. But before you head outside, we have skin safety tips from News 12 The Bronx, Rena Roy.
You may think the darker your skin, the safer you are from this.
I actually did think that have a darker skin tone, it wouldn't affect me as much.
But doctors say
everyone needs to use sunscreen. I don't care what color your skin is. Skin cancer does not discriminate.
Every 8 minutes, someone in the U.S. is diagnosed with melanoma, and every hour, someone dies from it. To help prevent skin cancer, the correct kind of sunscreen is key. You should look for SPF 30 or higher, 80-minute water resistance, and broad spectrum, which protects you from both UVA and UVB rays.
You should enjoy summer, enjoy the sun. We've had a horrible winter, but you have to do it in a safe manner.
And you probably think you're putting on sunscreen correctly, but doctors say most people aren't putting on enough. They say you should apply newer sunscreens like this stick, not just once, but 3 or 4 times in the same spot.
What ends up happening is because people are using less, an SPF of 85 ends up being like a 40, and a 40 a 20, and so forth.
You should also remember to apply the sunscreen 20 to 30 minutes before soaking up the sun, and even when it's cloudy outside.
Days like this, I would think it's not necessary to wear it because, you know, the sun is not really out as often.
I know it's important to use when I go to the beach so I won't get sunburned, but besides that, I don't really know a lot about it.
Reporting from the Montefiore Medical Center, Rena Roy, News 12, The Bronx.
The one young man said that he likes to apply it when he goes to the beach. So many people are very good at applying it when they go to the beach only. Somehow they don't think that they're getting color walking up and down the street with their dog or in their garden or at a park. I mean, like the beach is the only place they use sunscreen, okay? So that's interesting too. All right, now this has a clock on it and has 1 hour. Why do you think that? It says 1 o'clock, but I'm thinking of it as 1 hour. What do you think I mean by that?
1 hour, a patient dies.
A patient dies from melanoma every hour. It's the leading cause of cancer death in women ages 25 to 30, and second only to breast cancer in women aged 30 to 34. So we have a lot of work to do. And why do you think women, they go tanning to the tanning salons, plus they outside. So they're doing double duty, okay? Double damage. 96%, why do you think that's up there? If you get a melanoma taken off early, you have 96% survival rate. Okay, so it's good to do our education as nurses so that we can prevent cancer deaths. If you were born in 1935, your risk of getting skin cancer was 1 in 1,500. As time has marched on, look what's happened. In 2012, it's 1 in 5 for any type of skin cancer, not just melanoma, all right? All the non-melanoma skin cancers. 1 in 5. What has happened in that time frame? A lot has happened since 1935. But what do you think? The tanning salons. What else? The amount of clothing a person wears, especially to the beach, right? Very, very tiny bathing suits out there, right? More leisure time. People are wanting to go out and go to beach vacations more than they used to. The ozone layer. Okay. See how smart everybody is? You know all these answers. Look at how much information we can teach our patients, and that would be great. So we also have to fight against things in the community on media that teach our young people especially to want to be tan and to have a tanning bed in their home. And that's what Snooki wants people to do. Okay, she helped to open up a tanning bed, tanning salon in Lindenhurst a couple of years ago, and everybody got $5 tan. 200 young girls came because they wanted to meet Snooki, okay? Don't ask me why. Bob Marley is someone I would have loved to have met, but I couldn't. I didn't have that opportunity. What did he die of? Melanoma, okay? So this is something important to understand, that anybody who has skin can get skin cancer. People of color, are they at less risk of getting skin cancer? Yes, it's less likely, but they have a higher mortality rate because they tend to disregard a change in their skin, thinking, oh, it can't be skin cancer because I'm dark. It's okay, I have enough melanin to protect my skin. But in fact, you sometimes don't, all right? So what does skin cancer look like? Squamous cell carcinomas can look like a scab. It can crust and it can bleed easily and it can be itchy. It doesn't have to be, okay? But that's some of the signs and symptoms that a person would have. A basal cell carcinoma looks more like a pimple that has burst. Sometimes it looks like a pimple. Sometimes it looks like an open wound like this. And it's more in places that are always getting the sun, like your face, okay, and your hands, and your forearms, your ears. So why do we talk about a wide brim hat? To cover the ears and the back of your neck. You ever hear of a red neck? That's because their neck got red, okay, and that's not good, all right? So the wide brim hat will really cover you. A baseball cap is okay, but it's only going to cover about 50% of your nose, all right? So, and it's not going to cover your ears or the back of your neck. So it's better to wear one of those nice, pretty, floppy hats, okay? They're good. Or the ones from Australia that are straight brim hats. Squamous cell can also look like a scar and a waxy kind of appearance like this. So they can look different. And so if you're examining your patient's skin, you want to just point out the things that look different or that have the patient reports have changed. This is a basal cell carcinoma. It can be mistaken for a mole or a pimple. And in fact, I had a basal cell removed from my back. I was writing my dissertation on skin cancer, and I kept on having this itchy area on my back that I couldn't see. And when I would shower, I'd be like, oh, wow, what is that? I asked my husband to look, who's a lawyer, and he said, oh, it's just a pimple, forget it. And I said, well, I'm not going to listen to you. And, and so I went to the dermatologist, and they biopsied, sure enough, it was a basal cell carcinoma. So, I'm more at risk. Again, Irish skin. I'm not supposed to be at Jones Beach. A squamous cell can also look like this, where it's indented in the center and crusty and has a rim around it like that. And again, a different kind. So they can be puzzling, and I'm sorry to say it's not that easy. In fact, last Saturday I was with a dermatologist when he was doing a skin cancer screening because I wanted to learn more and more about the differences of these kinds of skin cancers, what they look like, the different appearance in different people, and it's surprising how different things can look. So we have a lot of learning to do about it, but if we can teach about the sun protective behaviors and teach patients that if something has changed, they need to see the dermatologist, we'll be doing a great service to the community. Okay, basal cell again looks like a big wound on his nose. Okay, and a melanoma. Now, a melanoma, you've heard those letters A, B, C, D, E, yes? What does the A stand for? Asymmetry. B? Border. What about the border? Irregular. Okay, C? The color. What about the color? Different colors, especially white, red, or blue if it's in there. Okay, it should be looked at. The D? Diameter, which would be 6, all right, but it can be less. And the E is for evolution, something that's changed. It used to be for elevation, but now we have it for evolution. If something has changed with that. And that's a concern. That's when you need to go to see the dermatologist and say, what is this, okay? Now, we heard from our 2 people here, the 2 nurses before, talk about their melanomas. Did they have all that A, B, C, D, E? No, they didn't. So that's even scarier, right? That it doesn't have to have all 5 of those characteristics. And you know that from different diseases that you're presented with as nurses. They don't have to have all the symptoms, right? When people go to the beach, sometimes they're afraid of a shark. What do you think the chances are of getting bitten by a shark? It's 1 in 65 million. So you've got to be pretty unlucky to have that happen. But getting a melanoma, 1 in 62, and getting any type of skin cancer, 1 in 5. They should be more concerned about the sun, which is a known carcinogen, okay? Tanning beds are known carcinogens. It's now been determined that's the highest level of carcinogen ranking that it gets from the World Health Organization. And Australia has banned tanning beds, and we need to do the same. Look at the impact that one nurse could have throughout her career on one, just talking about seeing her patients each day of her career. And that's not talking about the families and the neighbors and everybody else that patient's going to go home and say, my nurse taught me that I have to wear a hat when I do my gardening. My nurse taught me that my nurse saved my life. Because my nurse said that thing on my arm that has been changing and I've been ignoring, right, Karen? Now I have to pay attention to it. And I'm so glad that my nurse told me to see my dermatologist. Right? This is Nurses Week, guys. Let's step up to the plate and help the people in the community. So we use that Braden scale when we assess patients' skin. Yes? So you just add a little piece of education to this about some protective behaviors. You need to wear a hat, clothing, stay out of the sun during peak hours, which is really from 10 to 4, which is really a long time. So you don't really expect people to go out, not go outside, right, for all that time. But schedule going to the beach either early in the day or late in the day. You know, go late in the day. I like that. Go late in the day and bring a picnic dinner. And then people are starting to leave the beach because they're going home to cook. And you're like, I don't have to cook tonight. I'm bringing my picnic here. And this is great. And, right? And then you don't have that many peak hours of the sun. You can go at 4 o'clock and you stay 4 to 7. It's beautiful. It's a beautiful time. Here's Protecting Your Baby from the Sun. It's one of the brochures that we have. We want to teach parents, if you work in maternity or pediatrics, you want to teach parents to have their children use sun protective behavior from the beginning. They have these great products now for children and for adults of the clothing that has SPF in it. And it's really comfortable and it breathes very well. You don't get hot. I use one of those jackets. I got it from Costco. And I have an Australian hat. I use sunscreen. I put on one of those jackets. I even have gloves that I use for kayaking so I don't get blisters on my hands. I am not hot in the water. I am not hot. And I protect myself. Does my husband listen? No. He wears a baseball cap and he gets a red neck. And I keep talking to him, but what can I say? Lead a horse to water, right? But we can try to do this education. But if we have children start to change their behavior from the beginning and realize, I can't go outside unless I sunscreen and wear a hat. My mom and dad won't let me outside. And that's what happens in Australia. In the schools in Australia, children cannot go outside to play at recess in a school without a hat, sunscreen, and a long sleeve shirt. They have to stay inside and color or something. And you know that mom's going to have that hat in the backpack the next day. Okay, so I did some research with students on sun protective behaviors, and I had a control group where I just had a group where they just had a pre-test and then a post-test, no education. I had a lecture group that had the pre-test, a lecture about skin cancer, just like I'm doing now, right? And then a post-test. And then I had an intervention group where they had the pre-test, the lecture, plus using the skin analyzer machine, which you will have a chance to do. We have it in the back of the room. And to see if that would change their behavior, they take the post-test. Well, I'm happy to say the research worked, and they are willing to change their behavior. and they have increased their perception that they are at risk to having skin cancer. So this is what the machine looks like, and this is what a face can look like in there. See the blue, right? And the ultraviolet lights will point out the sun damage that you can't see by the naked eye. So it personalizes the risk for the person. So if we talk to especially young people that like to go tanning and stuff and say, you're wrecking your skin, it's going to look terrible. And you're more at risk for getting skin cancers. If we can do that and get to their beauty aspect of it, then we can change behavior, okay? So there was a bunch of young girls in the study, and they were mainly white girls in the study at Malloy College, okay? And they are more at risk. And this was a history of having skin cancer. Anyway, so the results just show the intervention group had significance in the perception, in some protective behaviors, and in the knowledge, okay? In the role of the nurse and in health promotion, the nursing students were already into that. So it didn't have a significant change of that because they already bought into that. But we have to have people buy into wanting to protect their skin. What about vitamin D? Some people say 10 to 15 to 20 minutes of sun a day for their vitamin D, okay? I think you're going to get that walking to and from your car even each day, right? And just going outside to get the mail or walking the door, whatever. But you really should protect your skin all the time. And I was talking to some dermatologists the other day, and they think the reference point of vitamin D must be off because everyone has low vitamin D. So we need to examine that. And that's all I had to say. Okay, thank you.